Hi friends, good evening and welcome back to my channel Mukambika Nursing. Friends, today we can discuss previous year question papers of MNS exam. The CBT exam, online exam is on 14th January and now itself people can download the admit card from official website. Let's see questions. Which type of bandage is used in ankle injury? Options: option A figure of 8, option B spiral, option C circular, option D reverse bandage. The bandage which is used in ankle injury. And the correct answer is option A figure of 8. Figure of 8 bandage is used to limit the joint movements of hands, elbow, knee, ankle and foot. Okay, here our question: bandage used in ankle injury is figure of 8. The next question: for right side cardiac catheterization, the catheter is inserted through options: option A radial vein, option B femoral vein, option C umbilical vein, option D carotid artery. For right side cardiac catheterization, the catheter is inserted to femoral vein. Option B is the correct answer. For right side cardiac catheterization, the catheter is inserted into the antecubital vein or femoral vein. Okay, through the vein, the catheter is inserted, femoral vein, and it goes to the right atrium and right ventricle and into the pulmonary artery. So, we can measure the pressure within the atrium, ventricles and the pulmonary artery. The next question: for left side cardiac catheterization, the catheter is inserted through options: option A radial vein, option B femoral artery, option C umbilical vein, option D carotid artery. For left side cardiac catheterization, the catheter is inserted into the femoral artery. Option B is the correct answer. For left side cardiac catheterization, the catheter is inserted in the brachial or femoral artery into the left ventricles. Okay, brachial or femoral artery into the left ventricles. Move on to the next question. The solution used for barium solor is options: option A barium chloride, option B barium nitrate, option C barium sulfate, option D barium citrate. Solution used for barium solor is barium sulfate is the correct answer. Barium solor procedure is performed along with barium meal. The filling and emptying of the esophagus is studied by using barium solor. Okay, the filling and emptying of the esophagus can be studied by using barium solor, and the solution used for this barium solor procedure is barium sulfate. Move on to the next question. The test performed to assess the secretory functions of the liver is known as options: option A Fishburg concentration test, option B phenosulfonaphthaline excretion test, option C bromosulfonaphthaline excretion test, option D augmented histamine test. Correct answer is option C bromosulfonaphthaline excretion test, that is performed to assess the secretory functions of the liver. The next question: the test that is done to study the ability of kidney to concentrate urine is options: option A Fishburg concentration test, option B phenosulfonaphthaline excretion test, option C bromosulfonaphthaline excretion test, and option D augmented histamine test. Correct answer is option A Fishburg concentration test, which is used to study the ability of the kidney to concentrate urine. Fishburg concentration test. Option A is the correct answer. The next question: which among the following is an example of crystalloids? Options: option A WBC, option B plasma, option C RBC, option D ringer lactate. Question: which is an example of crystalloid? And the correct answer is option D ringer lactate. There are two types of solutions that is used as an oleum expander, that is crystalloids and colloids. Crystalloids are mineral solutions For example, NS RL. Okay, here RL is there. That is our answer. And colloids are plasma oleum expander. For example, RBC, WBC, blood, plasma, and all. They are colloids. Examples of colloids. The next question, RL contains options. Option A sodium, potassium and calcium. Option B sodium, potassium, magnesium. Option C sodium, magnesium. Option D dextrose glucose. RL means ringer lactate contain. The components of ringer lactate include sodium lactate, sodium chloride, potassium chloride and calcium chloride. Here sodium, potassium and calcium. First option is there. So that is the correct answer, option A. Sodium chloride, potassium chloride, calcium chloride and sodium lactate is the component of ringer lactate. And the next question, potassium content of ringer lactate in millimole per liter is. Options, option A 130, option B 109, option C 4 and option D 50. Potassium content of ringer lactate is 4. Option C is the correct answer. Move on to the next question. Slow infusion of isotonic solution into subcutaneous tissue is called. Options, option A hypodermoclysis, option B plasmapheresis, option C dialysis, option D enteroclysis. Slow infusion of isotonic fluid into subcutaneous tissue is known as hypodermoclysis. Option A is the correct answer. The next question, the size of intravenous cannula in gauge used for neonates. Options, option A 28 gauge, option B 24 gauge, option C 22 gauge and option D 20 gauge. Intravenous cannula for neonates 24 gauge. Option B is the correct answer. 24 gauge is yellow color. Move on to the next question. What is the color of peripheral venous cannula 16 gauge? Options, option A pink, option B grey, option C yellow, option D green. 16 gauge cannula color. It is grey color. Option B is the correct answer. Different color and cannula we can see. 14 gauge is orange color, 16 gauge is grey color, 18 gauge is green color and 20 gauge is pink in color, 22 gauge is blue in color, 24 gauge is yellow color and 26 gauge is purple color. Okay, this is an important point. Maybe you can expect questions from this area. Move on to the next question. For intramuscular injection, the nerve should insert the needle into the muscle at an angle of. Options, option A 15 degree, option B 30 degree, option C 45 degree and option D 90 degree. The angle of insertion in intramuscular injection. That is the question. So the correct answer is option D 90 degree is the correct answer. The next question. While administering medication to a client, a specific drug is to be administered AD. What does AD refers to? Options, option A right ear, option B left ear, option C right eye, option D left eye. The abbreviation AD means it is a right ear. Option A is the correct answer. Abbreviation AD means right ear, AS means left ear. OD means right eye, OS means left eye. Okay. The next question, route of administration by which drug reaches the joint directly is known as. Options, option A intra-articular, option B intrathecal, option C intravenous, option D intra-arterial. Injections or drugs given into the joints are known as intra-arterial. Option A is the correct answer. Intravenous means into the vein. Intra-arterial means into the artery. Intrathecal means into the spinal cavity. And the next question, intraosseous injections is given in. Options, option A vein, option B bone marrow, option C spinal cavity, option D muscles. Intraosseous means into the bone marrow. Option B is the correct answer. Intravenous means into the vein. Spinal cavity means intrathecal or intraspinal. Into the muscles means intramuscular. Here intraosseous means into the bone marrow. Option B is the correct answer. Move on to the next question. 5 teaspoon is equal to how many milliliters? Options: option A 30 ml, option B 25 ml, option C 12 ml, option D 22 ml. 5 teaspoon is equal to 25 ml. That is 1 teaspoon is equal to 5 ml. So 5 teaspoon is equal to 5 into 5, 25 ml. Move on to the next question. 1 pint of 10% dextrose yield how much calories? Options: option A 100 calories, option B 200 calories, option C 300 calories, and option D 400 calories. Question: 1 pint of 10% dextrose yield 200 calories. Option B is the correct answer. Here are question. 10% dextrose yield how much calories? Okay, 1 pint is equal to 500 ml. So 10% dextrose contain 50 gram dextrose. Dextrose is a sugar. Sugar is a carbohydrate. So 1 gram carbohydrate yield 4 calories. Okay, so 4 into 50, 200. So the answer is 200 calories. The next question, a patient with an order of NPO can be given options. Option A, unlimited fluid. Option B, no food or liquids. Option C, small amount of ice. Option D, only liquids. NPO. NPO means nil per oral. Okay, so no food or no liquids. Option B is the correct answer. Move on to the next question. A symbol used for drug administering before sleeping at bedtime. Options: option A AZ, option B HS, option C OD, option D SOS. B for drug which is given before sleeping or at bedtime is HS. Option B is the correct answer. Abbreviation AC means before meals. PC means after meals. HS means at bedtime. OD means once a day. SOS means if necessary. So far we discussed the previous question paper from MNS exam and also important questions also I included. Surely these questions will helpful for your studies. So the next question set of questions we can see in the next video. If it is useful for your studies, please share it to your friend circle and subscribe my channel also.